Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is November 25th, 2020. You may have noticed that it's a Wednesday today, not a Friday like the weekly reports usually happen on, but it's just because tomorrow's Thanksgiving, and I wanted to get this out early. So we'll start as usual with our COVID-19 statistics. First off, worldwide, we have over 60 million cases and over 1.4 million deaths. In the United States, we have over 13 million cases and nearly 268,000 deaths. Currently, we're hitting about 2,000 deaths a day in the United States. This week, we got more information about the spread of COVID-19 from the Sturgis rally. You'll remember that we've talked about the Sturgis rally in a few of the different reports we've had. It turns out that Sturgis rally really was a super spreader event. The new report by the CDC traced 51 people in Minnesota who attended the rally and became infected. They found that those people infected 35 other people in Minnesota, and out of the 86 total, one died. The CDC was quick to point out that contact tracing almost never finds all people affected, especially with COVID-19, and the study was only done for Minnesota, not for any other states. There were likely many more Sturgis rally attendees who were infected, but asymptomatic, who spread the virus to others, who may have become infected and symptomatic. So we may never know exactly how big the spread was from the Sturgis motorcycle rally. Surges across the country, but especially in states closest to Sturgis in the weeks following the rally, suggest that the rally was a source of many infections and could have been one of the early major drivers for the numbers we're seeing now. We've previously mentioned the study in Kansas that showed that masks really do work to slow the spread of COVID-19. This week, more information has become available from that study. In counties with mask mandates, daily cases per capita dropped by 6%. That might not seem like much, but those counties that did not have mask mandates saw their numbers increase by 100%. So that's a huge difference, -6 versus positive 100%. So masks do help. As we've mentioned before, masks aren't 100% effective at stopping the virus. You may still get COVID-19 even if you're doing all the right stuff, but your chances are greatly reduced. There's also evidence that if you get COVID-19 while wearing a mask, your chance of experiencing severe symptoms is lower. It's also important to note that in the study, the counties in the study with reduced cases were not all rural or all urban or all one thing or another. There was a mix of a number of different factors in all the counties, those with mask mandates and those without. And so the CDC has definitely determined that the wearing of masks really was the reason for the reduced cases. Last week, we mentioned that a national mask mandate needs to happen. This week, a study from the University of Utah concluded that mask mandates do reduce the spread of COVID-19, and state-level mask mandates will do it better than county or city level. In fact, state-level mask mandates not only reduced cases of COVID-19, they also helped the economy by increasing consumer spending and the number of people actually visiting stores. One of the main arguments against any restrictions to stop COVID-19 is that the economy will suffer. This may still be true about lockdowns and closing businesses, but wearing masks will actually help the economy. So there really isn't any good reason not to wear a mask. Don't even get me started on the freedom thing. It doesn't reduce your freedom to wear a mask. Anyways, AstraZeneca, working with Oxford University, has announced the results of their vaccine trials. This is the third major player in the vaccines. Their vaccine is much less effective than the other two. If given in full doses, it's only about 60% effective. But if the first dose is given as only a half dose, and then the second dose about a month later is a full dose, then it has over 90% effectiveness, just like the other two vaccines that have finished their phase 3 trials. So looks like we have three good options now. They're all waiting for authorization from the government, from the FDA, to be able to start sending those out to everybody so we can start getting the vaccines. The AstraZeneca vaccine does have a couple of advantages over the other two. First, for storage, it only requires refrigeration, not freezing. That'll make it a lot easier to keep a large supply of vaccines available at hospitals and clinics, especially in developing countries. Second, it's estimated that it will be much cheaper than the other two main vaccines that we have now. AstraZeneca's vaccine should be about $2.50 per dose, compared to about $20 for Pfizer's. Moderna hasn't officially released pricing yet, but estimates are anywhere between $15 to $40 a dose. So as wonderful as having these vaccines will be, today we have a bit of a caution about them. None of these cautions affect whether you should get the vaccine or not, because you should. No matter what, you should get the vaccine when it becomes available to you. But first, let's go over the cautions. First caution is that vaccines do often have side effects. In the trials for these COVID-19 vaccines, most people didn't report any side effects beyond just the pain from the initial prick of the needle. That's basically it. The worst side effects, however, which were experienced by a few but still significant number of people, was similar to getting COVID-19, meaning felt fatigue, headaches, congestion, things like that. But it only lasted for a single day, sometimes a day and a half, and then it was gone. It's not like actual COVID, where you can go for days or weeks or months, if you're a long hauler, or where you can go into the hospital or even die. In these cases, it's just a day to day and a half of symptoms, and you're done. So there's no reason for us not to get those vaccines just because we think it'll hurt. The second caution is that vaccines take a couple of weeks from the time of injection to when they're effective. Your body needs to build up immunity after receiving the vaccine. You can't just assume that you're immune to COVID-19 right after you get the shot. Plus, in this case, with these COVID-19 vaccines, all three of them that are finished with their phase 3 trials already, they all require 2 doses about a month apart. So the first dose might help a little bit, but the combination of the two is what will really give you the immunity. The third caution is that we don't yet know how long the vaccine will last. It might last the rest of your life, or you might need to get a booster after a few months or years. We just don't know yet because of how new COVID-19 is. The fourth caution is that it will be a few months at least before we have enough vaccine doses available to get herd immunity working. The first doses will likely go to healthcare workers, and then the next doses will likely be given to those who are most vulnerable, and possibly some other essential workers such as store employees and things like that, policemen, other essential workers. The final caution is that we don't actually know yet if the vaccines stop the spread of COVID-19. We do know from the trials that they will keep you from getting sick. But the trials, unfortunately, were not able to test whether people could possibly still get it and just not get sick, and then just carry the virus and pass it on to other people. That just wasn't part of those trials. It's not what they were testing. So they weren't able to tell yes or no on that, whether you can spread it or not. Scientists currently believe that you will not spread it if you get the vaccine, just because pretty much all of the previous vaccines are like that for other diseases, but we just don't have the proof yet. If the vaccines end up not stopping the spread, then herd immunity just won't work. Basically, everyone will have to get the vaccine in order to not get sick. Thankfully, that's very unlikely to be the case. Almost for sure, herd immunity will probably start kicking in once we have enough people to have the vaccine. But that is just a caution. Just want to throw that out there. But again, it's very unlikely that that would be the case. So, what do all these cautions mean for us? First, the main takeaway is that we can't let up our guard just yet. Even when the vaccine is available, it would be a good idea to keep wearing a mask and following other guidelines until we learn more about how it all works. Everyone's tired. It's called pandemic fatigue. People are starting to not care as much about following the CDC guidelines because they're just tired of it all. The virus doesn't care if you're tired, though. Those of us in public health, we know it's important to keep telling everyone to keep your guard up. We know you're sick of it. We don't like to tell you it, but we keep doing it because we know it's important. Try to take care of yourself mentally and emotionally. If you're tired, if you just don't think you can handle the pandemic anymore, try and take a day off. Go chill in your house and just, don't go to work or anything or something. or go somewhere up in the mountains, get away from civilization, or even something even more simple like take a long soak in the tub or binge watch your favorite TV show, something. But take care of yourself. We got to get through this. Keep up our guard. It's getting close to when we were going to have that vaccine available for everybody, and at that time it should be pretty much controlled as long as everything happens like we think it will happen. Scientists have been really, really right so far on a lot of things. So if there's hope at the end of the tunnel, just keep it up. In many of our past reports, we've mentioned Sweden's non-response to COVID-19. They basically decided that they would do very little and just rely on herd immunity. This week, they admitted that they really don't see any evidence in their population of herd immunity. It's not surprising that despite a few missteps by scientists, for the most part, what the majority of scientists have been saying really is true. We're seeing proof of that now in many things. There's a few other things here from the CDC that I want to go over this week. First off, the CDC has warned once more that everyone should avoid traveling on cruise ships. Cruise ships are the perfect place to spread COVID-19. There have been multiple super spreader events related to cruise ships. It's just not a good idea. Just don't do it for now. Plan it for, maybe next summer. That will probably be safe, but not right now. The CDC has also signaled that they're looking to reduce the recommended quarantine time from 14 days to between 7 and 10 days if you have a negative test result. We need to remember, though, that you can't get a test right away after being exposed. Even the best tests typically you have to wait at least 3 days, some even longer than that, before you'll get an accurate test result. False negatives are much more common than false positives, and the reason for that is because a lot of times you just don't have enough virus in your system until many days after the exposure, and so it'll say you're negative, but give it a few days and you'll be positive. So some doctors are even recommending getting a second test a few days after your first negative test. If you get a positive test, it's almost for sure you are positive, but if you get a negative test, some doctors will say go get a second one, a few days later, just to be sure. Regardless of what your doctor says, the CDC currently has not changed their quarantine recommendation. They're just looking at the possibility. So for now, continue, waiting the whole 14 days, quarantine that full 14 days after exposure, even if you get a negative test result. The CDC and other public health organizations are also strongly warning everyone to please don't gather for Thanksgiving or Christmas. It just isn't worth it. There is a high chance of COVID-19 spreading a lot. We mentioned in previous reports that Canada, after their Thanksgiving holiday, they saw a major spike in cases, just 2 to 3 weeks after, which is basically the incubation period there. And so it has a very high chance of happening here in the United States also. There's already news reports of millions of people flying for the holidays, gathering against the CDC's recommendations. It really just is not recommended. Please, if at all possible, just don't do it. Please protect yourself, protect your loved ones. Don't gather. Try and use technology instead. There are a number of ways that you can use technology. Two of the most common ones are using Zoom or Microsoft Teams. Both of those are virtual meeting software or programs. And you can use that to have a video chat with multiple people. In fact, both Zoom and Microsoft Teams are removing their time limits for meetings for the Thanksgiving holiday. So you're not limited to just a few minutes at a time or anything. You can just leave it running the entire time. Set up a cell phone or laptop or something and just put it at the end of the table and, have your whole dinner. Even if it takes 5 hours to eat or do whatever, you can do that because there's no time limit for the Thanksgiving holiday with either of those programs. So there's more information below the video in a link or a few links there. So if you're not familiar with it, go down there, check it out. Check out Zoom and Microsoft Teams. Choose either one of them. They both work great. That's much preferred to going and gathering physically in person. Thank you for watching the Plain English Public Health Weekly Report for November 25th, 2020. As always, there's a bunch of links below the video that you can check out to see things that we talked about earlier and things that we didn't get to talk about. So please check those links. I'm Richard Greenland, and you have a happy and safe Thanksgiving.